Greetings. Welcome to our REDSHORT webinar for this Wednesday, September 6, 2023. My name is J.D. Thomason. I am an analyst with Red Sky Alliance, and today I will be walking you through a short discussion on some recent ransomware attacks involving the group Rhysida. As always, you can find information on related topics at redskyalliance.org. So here is the agenda for today. We'll begin by giving some background information on the Rhysida group, since they are a relatively new group. We'll include the type of work they're generally involved in and a few details on previous attacks. Next, we will give a brief overview on the specific ransomware typically used in their attacks. From there, we'll discuss a little bit about their targeting healthcare organizations and how that differs from other groups. So let's get started. So Rhysida is a ransomware group that has very recently surfaced. Their first known activity occurred in May of 2023, where they leaked documents that they claim to have been stolen from the Chilean army. Similar to other cyber threat groups, they describe themselves as a cybersecurity team aiming to help victims establish a more secure environment. For those who might be curious, Rhysida is actually a genus of centipedes, which corresponds to the logo displayed on the Rhysida dark web page. Even though we're focusing on attacks against healthcare organizations here, it is still worth pointing out that Rhysida targets organizations in a number of industries. Most of their targets operate in educational services or manufacturing, but target organizations have also been found in professional services, public admin, or other admin services. In terms of locale, target organizations tend to be located in either North America, Europe, or Australia. Rhysida attacks are initiated by deploying ransomware. This is typically done through the use of the Cobalt Strike penetration testing tool or by phishing campaigns. Data is exfiltrated from targets and victims are threatened with public distribution. Since the data is also encrypted on target machines, we can see pretty clearly that Rhysida employs double extortion. At the time of writing, Rhysida currently has the data for two organizations up for auction, Prospect Medical and Prince George County Public Schools. The auction for Prospect Medical is actually currently on hold. In addition to these auctions, Rhysida has made data available for a number of other organizations available on their site. Including Optimum Medical Solutions, Pierce College, University of West Scotland, and many others. The actual Rhysida ransomware is a 64-bit portable Windows executable file. The program is filed with main W, and its name is Rhysida-0.1. As mentioned previously, the deployment of this ransomware is achieved through phishing tactics or through the use of Cobalt Strike. Trend microanalysis suggests that the ransomware would typically arrive on a machine through phishing tactics, at which point Cobalt Strike will be used for movement within the system. PowerShell scripts are then deployed onto the system to download the ransomware payload, in addition to utilizing a script that is identified as Silent Kill to disable antivirus services. This script will also allow for the deletion of shadow copies, modifying remote desktop protocol configurations, and changing Active Directory passwords. Files are encrypted with a 4096-bit RSA key and the CHA-20 algorithm. Once files are encrypted, they are given a .rhysida file extension, and a PDF ransom note is dropped at the location with the name "Critical Breach Detected." In addition to the number on the executable file indicating that this is an early version of the ransomware, the software is noted as not displaying many of the features that one might expect, such as VSS removal, multiple persistence, process termination, or unhooking. There are a number of ransomware operations that claim to not intentionally target healthcare organizations. Some even go so far as to claim that they'll provide free encryption keys if these organizations are targeted by mistake. Given recent attacks, the Rhysida group does not appear to have this sort of policy. Rhysida has claimed responsibility for an attack against Prospect Medical Holdings, which is believed to have occurred on August 3rd. Company employees were finding ransom notes on their screens, much like the example we have over here on the right. The attack prompted IT staff to entirely shut down networks to prevent things from spreading. Prospect Medical Holdings is a USA-based healthcare company that operates 16 hospitals and over 150 outpatient clinics in several states. Rhysida claims to have stolen a terabyte worth of documents, in addition to a 1.3 terabyte SQL database containing approximately 500,000 Social Security numbers, corporate documents, and patient records. Optimum Healthcare, an organization in Australia, was also a victim of Rhysida's activities. In mid-August, Rhysida posted 186 gigabytes worth of data belonging to Optimum Health on their leak site. The data consisted of both medical files and employee data. In early August, the Cybersecurity Coordination Center of the United States Department of Health and Human Services put out a bulletin detailing Rhysida's activities and encouraging organizations to stay aware of the cyber threat landscape. They recommend that healthcare organizations institute phishing awareness training, network segmentation, and intrusion detection on systems and patch known vulnerabilities. So, let us wrap up. First, we gave some details on the brief history of the ransomware group Rhysida. They are a group that was first seen in May of 2023 and have been quite active in a number of industries since then, including education, manufacturing, and healthcare. The ransomware deployed in this group's operation is a 64-bit portable Windows executable. It will typically be deployed through phishing tactics, and it will use Cobalt Strike as a secondary mechanism for moving around. Files are encrypted with a 4096-bit RSA key and the Cha-Cha-20 algorithm. Unlike some ransomware groups, Rhysida appears all too happy to target healthcare organizations. 2 recent healthcare organization breaches can be attributed to Rhysida, involving Prospect Medical in the United States and Optimum Healthcare in Australia. The recent uptick in attacks against healthcare organizations has prompted the Health Sector Cybersecurity Coordination Center to advise healthcare organizations to stay vigilant in their protections against attack. And that is all for today. Thank you for joining us. I hope you enjoyed the material and found it useful. If you have any further questions on the subject, you can contact us via Jim McKee at jmckee@redskyalliance.com. As always, you can find information on related topics at redskyalliance.org. Have a nice day, and we hope to see you again next week.